My name is Jeff, and I'm 65 years old, and I'm going to be talking about my recent total ankle replacement surgery and recoveries. My story is about being an athlete and playing a lot of basketball. I played basketball from junior high up until about 12 years ago, when the ankle problems were the reason I had to quit. And that was my case. I had multiple sprains over the years. Actually, I've had surgery on both ankles to repair the ligaments and remove some of the arthritis and bone spurs and so forth. And ultimately, we decided that because my ankles are mostly bone on bone, it was time to do something more significant. I wanted to have the range of motion still. I live in the country, have chores to do outside, run machinery, and range of motion was important in my decision. And my podiatrist finally got on board with the idea that that I was a candidate for a total ankle replacement. So he recommended OMC, and Dr. Hare is the orthopedic surgeon. I talked to him about the options and his history with doing this surgery. It's obviously a significant surgery and not to be taken lightly. So I went home for a couple weeks and mulled it over and did some more research, watched some videos on YouTube again and again, and decided that it probably was something that I needed to go for. I particularly liked his protocol for the recovery, where I had met with other surgeons before, and there was going to be a long recovery. Dr. Hare's protocol is much shorter than that. And at this point, I'm just over 8 weeks out. The surgery went well. It took about an hour, he told me. I was in a cast for 2 weeks, and then 4 weeks in a walking boot, and I was able to start bearing weight after that first 2 weeks, which was awesome, but not without being gentle. You know, I had to be careful, and then after the first 6 weeks, then he saw x-rays and said everything was fine, so he put me in a brace, and now I'm about 2 weeks in just a walking brace. But I wear a shoe. Most people can't tell that I've had a total ankle replacement, and I'm in therapy, so I have exercises and stretching to do, and sometimes that makes it a little sore, but in general, I walk pretty well. And we've already scheduled the right side. So I'm happy enough with it that I'm going to have both of them done. There isn't a lot of extreme pain. You'd expect some pain, but it's very tolerable. I'm not fearful at all of the next surgery having a lot of pain. My advice for someone that's having a lot of ankle pain and arthritis, being told they have arthritis in their ankle, is that this is an option. Total ankle replacement is an option. There's plenty of information to understand what's going to happen. Dr. Hare, talk to him, and find out whether you're a good candidate and make informed decisions. It was a really good experience to correct my problem. Obviously, we wouldn't be here if I didn't have a problem that I needed help with, but OMC has has treated me very well, and I'm happy with the experience.